You may have been in clinic or talked to your physician and heard somebody say the term spinal stenosis. So that may be a term that you understand, or maybe you don't understand what it means. So I thought I would take a moment and explain what do we mean by the term stenosis and what relevance does it have. The nervous system is, as we know, inside of bone. The brain's inside of the skull, and then the spinal cord and the nerves are in the spine. And the spine protects the spinal cord and the nerves as the skull protects the brain. The function of the spine is to allow an upright posture, and there's all of the different segments in the spine that allow for motion. Well, as the spinal cord and nerves travel through the spinal canal, with arthritis or other kinds of problems, there can be a narrowing that occurs and causes pressure either on the spinal cord or on the nerves. That's what we mean by spinal stenosis. It's a narrowing, kind of like if you had a pipe that developed some buildup and is now blocked off and the water doesn't run through it very well. Or if you had a blockage of one of the vessels in your heart and now there's not as much blood flow. This is a scenario where there's a narrowing that's causing pressure on the nerves or the spinal cord. The spinal cord and the nerves don't function very well when they're under pressure. And if it's the spinal cord, you can have weakness or dysfunction of the spinal cord. If it's a nerve root, you can have pain in the distribution of that nerve root, which we call sciatica sometimes, or radiculopathy. You can have numbness, even weakness. Stenosis is treated surgically. There's some things that can be done to work around the problem, to strengthen the area, etc. But it's a structural problem. And so one of the most important reasons that we take patients to surgery for the spine is to address spinal stenosis. So hopefully that's helpful. Just think about stenosis as a fancy word for narrowing of the spinal canal and a resultant compression of the nerve roots or spinal cord.